Assalamu alaikum. Welcome you all to the next lecture, and this would be on the Adrenogenital Syndrome. So, as we were studying about the diseases of the adrenal gland, we've already studied about the Cushing's disease, and now we're going to do the Adrenogenital Syndrome. This is a disease that is prevalent due to either overproduction or underproduction of the androgens. So let's talk about the adrenogenital syndrome. So adrenogenital syndrome is an endocrine disorder that is caused by the excess secretion of adrenal androgens. Causes for this would be the congenital adrenal hyperplasia. Hyperplasia means whenever there is over multiplication of cells. Okay, hypertrophy means when the cell sizes are larger in an organ or in tissue, that is hypertrophy, increase in cell size, whereas increase in cell number is hyperplasia. So in congenital adrenal hyperplasia, the number of the cells which produce androgens, it is increased. They are present in large numbers since birth. That's why congenital. So it is a condition in which the fetus produces excess androgens. So the baby within the womb would produce excessive androgens. So this congenital adrenal hyperplasia would be expressed on birth in the babies. How it would be expressed, but would be the signs and symptoms, we'll just look at it in the next slides. Whereas if the onset of adrenogenital syndrome occurs later on, like at 20 years old or at puberty, the cause could be an adrenocortical tumor, that is tumor of the adrenal cortex. So I got a question about the tumors from a student, so I'm going to explain it. I've explained it already, I think last month, but let's explain it again. So our cells, they have three kind of abilities. Some cells can multiply freely, such as the cells of the liver. They can multiply freely on their own will. So if the liver gets damaged, new cells get generated. Moreover, epithelial cells, they multiply, keep on multiplying all the time. But the cells which can multiply freely still have a limit. Like when the normal number is achieved, there are some controlling mechanisms in our body that would control the multiplication to go any further. That means the cells would not exceed a certain limit. Then there are cells which can multiply in very small numbers, such as the cells that are present in spleen, etc. Then there are cells which cannot multiply at all, such as the cells of the neurons of the nervous system, the skeletal muscles, they cannot multiply. So if these cells, they start multiplying uncontrollably, that is, there is no limit to their multiplication, body cannot stop the cells from multiplying any further, that is known as a tumor, a growth, neoplasia, formation of new cells which cannot be controlled by the body, and it is a pathological phenomena, it is a disease. Now these tumors or neoplasias are of two types. They are either benign or malignant. Benign tumors are those tumors which they have multiplied and they keep on multiplying. There's no doubt in that. But the pace is slow, the speed of multiplication is slow. Moreover, they are only limited to a certain area, whereas the malignant tumors, they multiply at a faster rate. Moreover, they invade the surrounding tissue, as well as they invade distant tissue. That means if a malignant tumor is present in liver, the cells from that tumor would travel to kidney and affect the kidneys, or they would travel towards the stomach and affect the stomach. So they show metastasis, they affect other sides. So this is what a malignant tumor is. Malignant tumor metastasizes, whereas a benign tumor doesn't. Benign tumor only involves the adjacent characters, which are adjacent tissues which are present near the tumor, whereas malignant tumor can seed to tissues which are far away from the original tumor site. So liver tumor can go to brain, can go to kidneys, anywhere. Whereas if there is a benign tumor of liver, it would only affect the surrounding tissues in the liver. It would not seed out into the other organs. Moreover, benign tumor is surrounded on the all sides by a capsule, so it is encapsulated, well circumscribed. Adrenal tumor does not, malignant tumor does not have this kind of things. So an adrenocortical tumor can be another reason due to which excessive androgens can be produced. So what are its effects? If a adrenocortical tumor is present, or congenital adrenal hyperplasia is present in a female, she would develop viral characters, that is viral characters. That is, she would develop characters that are typically seen in males. And if it is present in males, in prepubertal males, that is males which have not yet reached the age of puberty, so they are 10, 11, 12, 13 years old, before the puberty, that is 14, 15 years, it would cause precocious puberty. That is, it would start developing features of a pubertal male, of a young, of an adult male. That is, the beard would come on, the mustache would develop, muscles would start developing, there would be hair growth in the armpit area, in the groin area. So all these features would elicit themselves before the person or the child hits puberty. And if it occurs, if a tumor starts producing androgens after puberty, that is at 16 years of age, or 20 years of age, or 40 years of age, the viralizing characters are difficult to detect because he has already hit puberty. So these characters would not, we would not be able to detect these characters, but androgens would be present in more concentration in the blood of that person. Now, in Androgenital Syndrome, the excretion of 17 ketosteroids are derived from androgens, adrenal androgens, in the urine, may be 10 to 15 times than the normal limit. So it would be increased 10 to 15 times. 17 ketosteroids, it would be a byproduct when the breakdown of the adrenal androgens take place. This finding can be used in diagnosing the disease in all of the patients, especially in the pubertal males, where there are no other characteristics that can be seen in the patient. We can take a urine sample and we would find 17 ketosteroids in an increased ratio, that is about 10 to 15 times more than the normal ratio. So in Adrenogenital Syndrome, the individual would have a 46XX chromosome. So the chromosomal picture would be that of a female. In males it is 46XY, whereas 46XX is in females. So in females the chromosomes would be normal as that of in females. So as I've told you, there are 46 chromosomes in the normal person. 23 comes from the male parent, whereas 23 comes from the female parent. These combine together to make 46 chromosomes. Now in females normally it is 46XX, and in males it is 46XY. Why are we discussing these? Because there are some syndromes in which there is trisomy, either an extra chromosome is present, so the patient would look like 47XXY, like that, or there is deletion 45XO. So in Klinefelters, in Turners, we would see these kind of things. So हिजड़ों का नाम सुना हुआ है ना, intersex child or intersex persons are known as hermaphrodites. True hermaphroditism is when the patient either contains 47XXY chromosomes or 45XO. Okay, so in this, the female, if she develops this androgenital syndrome, she would have normal genetic makeup as that of a female. That would be 46XX. The gonads would be normal, that is ovaries, which are normally present in all females. But the characteristics, the physical characteristics of that female would be male-like. So there would be masculinization of the female external genitalia. So how does it appear? There would be enlargement of clitoris to almost male penis. Her clitoris would enlarge in such a way that it would feel like a male penis, but it is not a penis, obviously. The labia majora would give the appearance of a scrotum, but there would be no testes. She would develop male type physical characters, that is, she would develop a beard, a deeper voice as that of a male, and occasionally may also develop baldness. Baldness is mostly present in males. So there would be less hair on the head, beard, big muscles, broad chest, just as that of males. Breast would not develop so much. So this female would look like a male. So we can see the adrenogenital syndrome in females. So as you can see here, the clitoris is big. It looks like a penis. The labia is fused, and it gives the picture of a scrotum. Whereas if we look at the physical characters, the breast would not be developed so much. The chest is broad, the shoulders are broad. So she gives the appearance of a male. There are big muscles. The body structure is just looks like that of a male. If this is present in males, the chromosome would be normal XY. And what would happen is, if there are adrenal androgens being produced in large quantities, it would cause adrenogenital syndrome in males. In children before 15 years of age, if this develops in males, they would show precocious development of secondary sexual characters and secondary sexual organs. So we can see in males there would be hypertrophy of muscles, there would be development of beard, there would be he would look like an adult, the male. In female child, she would also show beard. The breast development would not take place as normally, it would be slower, and a female may show virilism, baldness, development of beard, etc. in adult female. So this could be corrected. If there is a tumor, we could correct it via surgery, and if it is due to increased hormone levels, we could correct it with hormone replacement therapy. Now let's discuss a disease that is very important, that is Addison's disease. So what is Addison's disease? Addison's disease results from a failure of the adrenal cortices to produce adrenocortical hormones. This could be life threatening. It is a serious issue. So its most frequent cause is primary atrophy of the adrenal cortex. So adrenal cortical cells, they just shrink in size or die, and they stop doing their function, that is releasing the adrenocortical hormones. Now we already know the function of adrenocortical hormones. Cortisol is too much important for the development of the body, for the maintenance of normal metabolism of the body, or the production of energy. Aldosterone is very important in maintaining the balance of sodium and potassium, and adrenal androgens are also important for developing the sexual characters. But if these are not being produced, all of these functions would get disrupted totally. So in about 80% of the cases, the atrophy is caused by autoimmune destruction. That is, our own body starts producing antibodies that start destroying the adrenal cortex. This could only be treated by suppressing the immune system. This situation can also happen in tuberculosis of the adrenal gland. So tuberculosis is a multisystemic disease, multisystemic. So the general concept is that tuberculosis infection, that is infection by a Mycobacterium tuberculosis, only involves lungs. But that is only one presentation of the disease, that is known as pulmonary tuberculosis. Apart from that, it may also involve intestines, that is intestinal tuberculosis. It may also involve other glands. It could happen at any place. The granuloma formation could start happening at any place in the body. So if TB of adrenal gland occurs, it would destroy the normal structure of the adrenal gland. It would disrupt the normal function of the adrenal gland. This thing can also happen in malignancies, that is the malignant tumors that can originate from the adrenal gland or can originate from any other part of the body and involve the adrenal gland. The important ones are known as the multiple endocrine neoplasia, MEN syndrome. In MEN syndrome, adrenal gland gets involved sometimes. So what would happen? If there is a tumor, we can remove the tumor. If it is TB, we can treat it by anti-tuberculous treatment, ATT. Or if it is autoimmune destruction and the adrenal has not been completely destroyed yet, we can start using steroids to suppress the autoimmune system, to suppress the immunity, so that this autoimmune destruction stops. But what happens if the adrenal is totally destroyed? We have to give the patient lifelong, till death, continuous treatment with steroid replacement therapy. We have to replace every hormone, every enzyme that is produced by the adrenal cortex by giving it orally to the patient. So what are the features of the Addison's disease? Remember, this is one of the most favorite diseases of the examiners. This would be asked again and again, not only in your exams but in Pakistan Medical Commission licensing exams, that is the NLE exam, and it would be asked in FCPS exam. It would be asked by your professors during rounds. It would be asked everywhere. So remember, the diseases of the adrenal gland, of all the glands, are important, but Addison's is one of the most important ones. Apart from this, hyperthyroidism, very common and very important diseases. So due to Mineralocorticoid deficiency, if there is deficiency of aldosterone, electrolyte imbalance would occur. That is, the kidneys would not conserve sodium and it would result in hyponatremia. The kidneys would not excrete the potassium normally that should be excreted, and there would be hyperkalemia, that is increased potassium content in the body, in the blood, and there would be acidosis because hydrogen ion would not be produced and released, bicarbonate would not be conserved, so renal acidosis would occur. There would be loss of extracellular fluid volume due to sodium being released in higher quantities. So where sodium goes, water goes. If the sodium is being excreted in higher quantities, water is being excreted in higher quantities. So that could lead to decreased extracellular fluid, that can cause hypovolemia, decreased volume of blood in the body, hypotension, that is decreased blood pressure, and shock. Shock is a condition when there is hypoperfusion of vital organs, that is decreased blood supply to the vital organs. Vital organs are our kidneys, our brain, our heart, our liver. These are all vital organs. So if the blood supply to these parts are decreased, multi-organ failure can ensue and the patient can die within 15 to 20 minutes. So due to deficiency of mineralocorticoids, this much could happen. We've only discussed aldosterone yet. So just imagine what could happen if there is deficiency of cortisol and if there is deficiency of adrenal androgens. All of this combined, this makes Addison's disease very deadly and very difficult to treat. So if there is reduced production of all the corticoids, there would be decreased mineralocorticoid effect. RAS system would not work. The renin-angiotensin-aldosterone system would not work anymore. There would be inadequate reabsorption of sodium and water and reduced tubular secretion of potassium and hydrogen ion. That would lead to decreased blood sodium levels or hyponatremia. More hydrogen retention, that would cause metabolic acidosis. Potassium retention, that would cause hyperkalemia. So potassium intoxication would cause hyperkalemia, that can cause muscular weakness and wasting. There would be increase in blood urea levels eventually. There would be excessive loss of sodium and water in urine, that is known as polyuria. So if the patient is producing huge quantities of urine, that is more than 2.5 to 3 liters in 24 hours, that is known as polyuria. It is seen in diabetic patients, it is seen in Addison's patients, etc. Potassium levels in urine would fall. Potassium would start accumulating within the body. So what happens if blood sodium level falls or hyponatremia occurs? It would cause the blood to follow the water to follow the sodium outside the body. So body fluid volume would decrease, which would cause dehydration. That could cause decrease in blood volume, and that would eventually lead to decrease in blood pressure or hypotension. If there is decreased blood pressure in the body, this could lead to increased risk of cardiac failure or circulatory failure. This would lead to shock, that is hypoperfusion of the vital organs. The patient would undergo multiple organ failure and the patient would die eventually. So incomplete destruction of glands produces Addison's disease. If there is complete destruction, all the things are not secreted, the patient would die. There is no other way. The patient cannot survive this event. So if there is decreased glucocorticoid production, that is decreased production of cortisol, what would happen? The patient would not be able to maintain normal blood glucose concentration between meals. So hypoglycemia would occur during starvation periods. So what happens is, we take our breakfast at about 8 a.m. Then we take our lunch at about 2 p.m. and dinner at 8 p.m. normally. If we decide to skip a meal, that is, let's suppose the meal in the afternoon at 2 p.m., as we do in fasting, what happens is our blood sugar level starts to fall after a few hours, after 3 or 4 hours, due to the starvation. So normally what happens is, the liver would take up this as need for more glucose. So as I was saying, during the periods of starvation, the liver takes up the role to produce glucose, so that energy can be continuously provided to our body, because the main energy production is via breaking down of glucose within the cells. So glycogenolysis starts occurring in the liver, in the muscles. And what happens is, normally the extra glucose is stored in our body in the form of glycogen in muscles and in the liver. The liver is the biggest storage unit. So the glycogen would be broken down, the proteins would be broken down, the fats would be broken down for the production of more energy for the body. Moreover, new glucose formation would start occurring, that is known as gluconeogenesis within the liver. And that is how we survive the period of starvation. But in a patient who does not have cortisol, what would happen? The patient would not be able to survive this period of starvation. He would go into hypoglycemia, and after hypoglycemia, if it goes on untreated, if the patient does not eat something immediately, it would sit in the hypoglycemia coma, that is shutting down of the major organs of the body. After that occurs the death. The brain cells would start to die and the patient would eventually die. So this is what happens if the cortisol is insufficient in the body. So there would be no gluconeogenesis in the liver. There would be reduced mobilization of proteins and fats from the tissues for the production of more energy. And there would be decreased resistance to stress and infection. So let's suppose a patient has hypocortisolism, that is decreased cortisol level in the body. The patient during the period of starvation, he or she feels starved, blood glucose starts going down, starts having panic attacks, his head starts spinning, and he starts taking the food immediately. So he is surviving by this means. So he would survive the starvation. But what would happen if the patient is under any kind of stress, that is during exercise or traveling or running or doing anything else, or if the patient contracts an infection? What would happen then? In increased stress or in infection, we need more glucose, we need more energy that could not be provided to the patient through the liver, through other organs, because there is no cortisol in the body. So eventually the patient's storage of energy would get depleted and the patient could die at any moment only due to cortisol deficiency. So this is how serious this disease is. So if there is inadequate production of glucocorticoids, glucose formation from proteins is depressed within the liver and blood sugar level would start to fall. This would cause a great muscular weakness and wasting of muscles, great loss of weight. This is what happens at the start. Gastrointestinal upsets, that is vomiting or diarrhea, could occur. Anemias would occur, that is decreased red blood cells production in the body. Pigmentation of exposed and pressure areas of the skin would occur due to increased ACTH levels. Adrenocorticotropic hormone would be released in huge quantities because cortisol is not being produced in the body. Its normal level is not being maintained. That is why ACTH would be produced in huge quantities. The melanin stimulating hormone, that is a precursor of ACTH, that would be produced in more quantities, and there would be pigmentation on the exposed areas. The skin would get darkened. The patient would have dehydration because cortisol also has effect, aldosterone like effect on the kidneys, so there would be dehydration, and the crisis would occur especially if acute infection complicates the condition of the patient. So how do we treat a patient with Addison's disease? To treat a patient with Addison's disease is a necessary task. We cannot just let the patient be. So an untreated patient with total adrenal destruction would die within a few days to a few weeks because of weakness and circulatory shock. Yet such a person can live for years if small quantities of mineralocorticoids and glucocorticoids are administered orally or via IV daily. So these hormones are given exogenously. So this Addisonian crisis I'll explain in the next lecture, I guess, and we would be starting pancreas in the next lecture too. So see you in the next lecture, inshallah. Take care. Allah Hafiz.